Frontline healthcare workers are often the hidden heroes of this pandemic, while our next guest, Chelsea, is absolutely no exception.
Travel nurses are the country's last line of defense. We'll go to the worst places in America, and we will try to keep as many people out as possible with what we know. I have seen more doctors and nurses cry and break down, more families grieve, more deaths than I ever thought I'd see in my lifetime. I've worked in 6 hospitals and 4 states since the end of February. Every single patient I've had for months has COVID-19. In the beginning, in New Jersey, it was disorganized and chaotic. Nobody knew what to do with these patients. PPE shortages pretty much everywhere. Then CDC and the World Health, they changed COVID-19 from airborne to droplet contact. And they took away the N95s we had in our possession and that we could use surgical masks. And we'd pretty much be risking our lives. And within that week, I started feeling symptoms. And I got sick, and my family tested positive. So it made me feel guilty and broken, because if they died, it would have been my fault. I prayed a lot. Thank God it never reached my grandpa. After New Jersey, I went to work in New York. It was post-apocalyptic. They turned every floor of the hospital into an ICU, including the cafeterias. The ratios went up to 1 nurse for 8 patients. Normally the ratio is 1 to 2 patients in the ICU. We had to put limits on how long we could do CPR and which people could be left for dead or had a chance of surviving. It was disaster mode. After New York, I went to Texas. Staff felt defeated. There were more people than I expected who did not believe the virus was real. First COVID-19 patient that I had who passed away, his last words were, "I don't have the virus." I would educate families on their loved ones who were dying or dead, who weren't wearing face masks, and after I explained COVID-19, they would all put face masks on. Until it really hit home, they didn't understand how real it was. Every patient has been vulnerable. They can't have their family, friends, or loved ones at their bedside. We hear their last words. We're the last people to touch them, to see them. We're the last friend that they'll ever have in life. The end definitely gets ugly and hard. I became good friends with a patient, and she wasn't doing good. I remember just hearing the family cry on the phone. And then I went to the bathroom and I cried. And within the next week, she passed away. I feel like I was letting everyone down. I wanted to do more. I wanted to do more for everyone. And I couldn't. I just started feeling so broken. I don't want people's family to die.